Good day. Thank you for joining us. This is Panorama on the network service of the NTA. I'm Ruth Aguela. Welcome. Let's begin with the latest update on COVID-19 as at 9:30 p.m. on 7th of April 2020, additional 16 new cases were reported in Nigeria, 10 in Lagos, 2 in the FCT, 2 in Oyo, 1 in Delta and 1 in Katsina, bringing the total number to 254 in Nigeria. Of the total number, 44 were discharged and 6 dead. In another development, Governor Aminu Bello Masari of Katsina State has confirmed the death of Dr. Aliyu Yakubu, a private medical practitioner in Daura local government area of the state, as a result of COVID-19. Governor Masari, who confirmed the death during a news briefing, said late Dr. Yakubu, who was a proprietor of a private clinic in Daura, returned from Lagos and immediately isolated himself at the Air Force Reference Hospital, Daura, where he died 2 hours later. The governor explained that the disease samples were taken to the Nigerian Center for Disease Control, Abuja, where it was tested positive of COVID-19.
Our medical response team are in Daura now, trying to meet all those that he contacted or interacted with since his return to Daura.
Governor Masari there giving an update of the patient who died. All right, more on COVID-19. The Presidential Task Force on COVID-19 has assured Nigerians of President Muhammadu Buhari's unwavering commitment to containing the spread of COVID-19 in the country. Chairman of the task force, Boss Mustafa, gave the assurance at the Lagos State Government House in Marina after leading all the members of the team to inspect and assess facilities at some of the isolation centers in the state. Let's hear from Nosa Osula.
The Presidential Task Force team was earlier conducted round the isolation centers by Governor Babajide Sanwo-Olu at the 110-bed space makeshift isolation center within Mobolaji Johnson Arena, Onikon, the first port of call. Boss Mustafa described the facility as first class, pointing out that it would help in the management of those affected with the coronavirus disease. The chairman of the task force, who commended Governor Babajide Sanwo-Olu for his proactiveness and the media in Lagos for wide reportage since the outbreak of COVID-19, urged them to report anyone with COVID-19 symptoms who might not want to submit for medical isolation.
At the end of our evaluation, a certain set of recommendations and advice will go to Mr. President. And at that point, he and he alone would take the decision as to when the lockdown would either be extended or it will stop.
Governor Babajide Sanwo-Olu, who commended President Muhammadu Buhari for his leadership and support in the fight against COVID-19 in Lagos and the country at large, assured residents of continuous collaboration between the federal, state governments and international organizations to contain the spread of the virus.
We also have facilities in Ekpe, we have at Alimosho, we have in Lekki, we have in other places that are just waiting in the event that we need to activate and clear those facilities, especially for quarantine.
The Minister of Health, Dr. Usagi Ehanire, assured Nigerians of the preparedness of other states of the Federation to contain the spread of coronavirus. The team earlier inspected.
Let's look at humanitarian intervention. The Ministry of Humanitarian Affairs, Disaster Management and Social Development is working to expand the number of most vulnerable Nigerians captured in the social register. The Minister, Sadia Umar Farouk, was speaking at a meeting with leadership of the National Assembly on the distribution of COVID-19 palliatives. National Assembly correspondent Ignatius Onkwo reports.
The Minister of Humanitarian Affairs and Disaster Management, Sadia Umar Farouk, arrived Senate conference room to brief leadership of the two chambers on the ministry's mode of operation in the heat of the coronavirus lockdown. The legislators demanded to know the state of COVID-19 aid distribution to the most vulnerable Nigerians, how the ministry arrived at its list, and the geopolitical spread of the palliative.
The National Assembly feels that we need to work together with the executive arm of government to ensure that the most vulnerable people benefit from the Empower and so many other projects we have under the SIP.
So on our own part, the first thing we need to do and run with it is to codify what you're doing and put it in law.
The minister explained that the palliative in form of food is to be handled by the National Emergency Management Agency, while her ministry is handling the conditional cash transfer and other components of the social intervention program.
You may recall Mr. President also directed that we should give 2 months advance payment to these poor and vulnerable households. And that was what I also flagged up in Kwali.
The ministry is using the already existing social register in the distribution of the funds, as the minister also explained modalities for the continuation of the school feeding program now that schools are not on.
Rather than giving the cooked meal, since students will not be in school, so we're identifying the households where they come from to take this 1 month food ration to them.
The meeting was also to make the process of identification of vulnerable Nigerians more inclusive. From the National Assembly, Ignatius Nkwo, NTA News.
Thank you, Ignatius, for that. Let's look at more issues revolving on COVID-19. We have a guest just joined us. She is the NAFDAC Director General, Professor Moji Adeyeye. Thank you very much for joining us, ma'am.
Thank you. It's good to be here. Thank you.
All right, now let's begin this way. As a regulatory body, following claims of the efficacy of chloroquine, what would you say to Nigerians now, and what is NAFDAC doing in that regard?
Thank you very much. Chloroquine is an anti-malaria that was discontinued many years ago from being used because of resistance of the parasite to the drug. And right now, it is combination anti-malaria drugs that are used. However, at the start of the COVID-19 pandemic, or right, at the beginning of it, there were a lot of research that was going on, especially in China. There is what you call in vitro research, meaning in the lab, using cells or cell lines. And thereafter, they started clinical trials using human beings. The in vitro lab research showed that chloroquine and another drug, remdesivir, are effective in killing the virus. That is in vitro in the lab. Soon after this publication, another publication was made, which was actually full clinical trials. It had 100 patients in the trial, and the conclusion, and it was only chloroquine that was used. The conclusion was that chloroquine was superior to the control, and that all the patients recovered. As a scientist, my function, aside from being a regulator, is to report what is going on as it relates to drugs and drugs that can be used for clinical trial treatment, not drugs that are approved for COVID. There is no drug that is approved for COVID-19. When you see a drug that is promising, a clinical researcher can use that drug for clinical trial treatment. And that was the essence of my press briefing on March 20.
Okay, Professor, let me hold your thoughts there. Now, when the whole claims of the efficacy of chloroquine, Professor, can you hear me? When the whole claims of chloroquine came out about the efficacy of it, we saw panic buying for Nigerians, and we saw the self-medication. What action did NAFDAC took at that time?
Actually, self-medication, unfortunately, is part and parcel of our culture. First, because most people go to the pharmacist to buy medicines. Most of Nigerians go to the pharmacist or patent medicine dealers to buy medicine. So that is a problem in our culture. But after that press briefing, I also went on channels, went on TVC to emphasize the fact that people should not use chloroquine without consulting their doctor. They should not use chloroquine even if they are exposed to somebody that has COVID-19 without consulting their doctor. I also stated this on the FRCN radio, that self-medication complicates matters. Even if it is part of our culture, when it comes to COVID-19, our people should know that it is the doctor that they should contact first if they think they are exposed. Self-medication complicates matters in the sense that you may not know how much you're supposed to use. If you cannot reach your doctor, you should contact your pharmacist. Your pharmacist will discourage self-medication and, of course, direct you to a doctor if you don't know where the doctor can be found. So the emphasis is to consult the medical doctor or go to the pharmacist to talk about whatever need they think whatever drug they think they need. But I know the pharmacist will direct them to a doctor.
Okay, Professor, I know that there was a time chloroquine was banned for the treatment of malaria. Now, if people are having this panic buying of the drug, is there any plans by NAFDAC to also put a ban on the drug so people don't have access to it?
NAFDAC cannot ban a drug that is being tested in the clinics for clinical trial treatments. Chloroquine now is on WHO website, along with one or two other drugs that have been found through research, clinical research, to be effective. But it is not for consumption on a routine basis. So NAFDAC cannot ban. In fact, the role of NAFDAC is to ensure that for clinical trial treatment, the drug is available. NAFDAC is in the middle of clinical trial. For example, if a drug is not available in the country and clinical researchers submit their protocol, their clinical protocol, and they indicated that the drug is not available, NAFDAC will give import permit for that drug. If it is available locally, NAFDAC will guide the researcher in terms of getting the drugs locally. So NAFDAC cannot ban a drug that has been proven in clinical trial treatment to be effective. However, it has been proven to be effective in other climes. We have to test it in our own culture, in our own environment rather, because what is good in the Caucasian population may not be good in our own population. That is why we are assisting or guiding Lagos State Ministry of Health in the clinical trial that they are about to start. NAFDAC has been working with them to ensure that the process is expedited, and they're going to use chloroquine as one of their drugs.
All right, thank you very much, Professor Moji Adeyeye. Thank you very much for your insight on Panorama. All right, we've been talking to the DG NAFDAC. All right, let's look at more issues on COVID-19. The Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development says only the vulnerable will benefit from the 70,000 metric tons of food items released by the federal government. The Minister, Sadia Umar Farouk, clarifies this as the ministry takes delivery of the food items from the Federal Ministry of Agriculture and Rural Development in Mina, Niger State. Musa Baba Aliyu has that report.
The food items released to the Ministry of Humanitarian Affairs, Disaster Management and Social Development by the Federal Ministry of Agriculture consist of 35,000 metric tons of maize, sorghum 25,000, millet 5,000 and cassava flakes known as gari 5,000 metric tons. They are meant for distribution to Lagos, Ogun and the FCT as a palliative measures to cushion the effects of COVID-19 lockdown directives in the three areas. The warehouse here located in Mina, Niger State capital is housing more than 25,000 metric tons of assorted food, including gari, maize and sorghum. Out of the figure, 12,500 metric tons will be handed over to Ministry of Humanitarian, Disaster Management and Social Development for on distribution.
We have 10,000 of maize and 2,500 of gari. And these are going to part of it will be going to at least the three frontline states.
Minister of Agriculture, Mohamed Sabananono, and that of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, streamlined how the food items would be lifted and distributed to beneficiaries. They agreed that Mina Center should serve Lagos, while that of Lafia would be moved to Abuja, and Ogun State will get its own delivery from other centers.
Mina being a fairly centralized place, from here we intend to move gari into Lagos and Ogun State. Maize, NEMA will determine when it is going to moved.
NEMA is in charge of the logistics to distribute these items to the populations that are affected by the lockdown. 25% of the population of the state, those are the ones that we are going to reach out to. And these are mostly the vulnerable in the state.
The director in charge of strategic food reserves says all the food items are being transported concurrently from all the centers. From Mina, Niger State, Musa Baba Aliyu, NTA News.
You're watching Panorama on the network service of the NTA. Let's pause for some messages. We're back. Thanks for staying tuned. Reports just reaching us says fire got part of Treasury building house of the housing the Accountant General Office of the Federation. The building of the Accountant General Office of the Federation there in fire. Let's look at how residents of Abuja are experiencing the lockdown. It's day 8 of the measures to control COVID-19, but they're taking it with mixed feelings. Now, visits to various locations in Abuja by NTA correspondents reveal this. Najatu Tijani compiled the reports.
We have some people who are being turned back for not being able to show a proper ID identification and give good reason.
All right, that report seems not to be fully ready, but we'll definitely bring it to you in our subsequent bulletin. Let's move on to more issues on COVID-19 with the list of measures put in place, complemented by facilities in preparation for eventualities. Sokoto State is being proactive and vigilant in its bid to curtail the spread of COVID-19 to the state. Musab Abukar visited one of the facilities and now reports.
At the face of COVID-19 pandemic, ventilators like this is the state's line of defense and most valuable life-saving assets. This is Usmanu Danfodio University Teaching Hospital, one of the centers in Sokoto designated for the containment of COVID-19. They provide technical support to task force team and complement other designated center in Amanawa.
Important things we have done. We have formed the Infection Prevention Control Unit, which screens all patients that come to the institution. We use infrared thermometers to screen all people with fever. Our health personnel have been enlightened and they have been informed that any person that has the features suggestive of COVID-19, including the contact with person with COVID-19, should be alerted. We should alert the Infection Prevention Control Unit so that they screen him and then they take him to the isolation unit.
With a viral infection overwhelming health systems around the world, flattening the curve remains most viable option to make available facilities like this count. In Sokoto, I am Musa Abubakar, NTA News.
Let's take you to Walker, where about 1,000 indigent and vulnerable people in Ayamelum local government area of Anambra State have received the conditional cash transfer from the federal government. Nwabofo Unye reports that the beneficiaries were full of appreciation to President Muhammadu Buhari for his benevolence in meeting their financial needs in the face of COVID-19 lockdown.
The federal government conditional cash transfer program beneficiaries in Ayamelum are predominantly farmers, as the council area is known with rice and fish production. Beneficiaries are from Anako, Omo, Umumbo, Ibaku, Ifitogware, and Omase communities. The household uplifting program, otherwise known as the conditional cash transfer, aimed at responding to deficiencies in capacity and lack of investment in human capital of poor and vulnerable, which took place in Ayamelum, has touched the lives of farmers positively. Some beneficiaries say the conditional cash transfer came at the right time to mitigate the economic impact of coronavirus lockdown and at a time of the beginning of farming season. The beneficiaries promised judicious use of the money received.
I'm very, very happy because the money is really helping me. At least since last year, my condition has changed.
I use the money for train my children. For buy market, I sell.
For the little we are having, we appreciate. And we are begging them to put more, to add more.
Some leaders from the communities also commended the government initiative to contain the COVID-19 pandemic.
The beneficiaries are very happy. They are using it to train their children. They are putting it into business.
I commend our President Buhari to helping my people and the others for the cash transfer.
The desk officer conditional cash transfer program, Mr. Mike Okechi, said the program is hitch-free in Anambra State.
Last week, they were paid 10,000 naira stipend. They were very happy.
The conditional cash transfer by the Ministry of Humanitarian Affairs, Disaster Management and Social Development was carried out simultaneously in Katsina, Nasarawa and Anambra State. In Ayamelun local government area of Anambra State, Nwabofo Unye, NTA News.
All right, let's take you back to the fire incident we reported earlier. Our correspondent, Mia Ogidi, is back from the scene. Let's see it.
Just like these other journalists that are standing outside, so we were as well, because we were not allowed access to the scene of the incident. But few minutes later, the Commissioner of Police and some of his colleagues in the Federal Capital Territory who entered inside and saw everything themselves told us what happened.
10:05 this morning, there was an alarm raised that there was a fire incident in the Accountant General's office. We quickly mobilized firefighting teams to come from different locations to Abuja so that we can contain the situation. Security was in place NEMA and all relevant agencies were invited. We've been able to contain the situation for now. What remains is that we are commencing investigations to determine the source of the fire.
Because I see the entire building that was affected or section, and if it is which part?
No, just a section. I cannot tell you which section. I'm not a staff of AGF, but part of the section was part of the building was affected, and the fire has been extinguished.
Okay. What?
Our correspondent there, Mia, reporting from the fire scene of the Office of the Accountant General of the Federation here in Abuja. That's it on